Hello everyone, welcome to Move Well, Live Well. We get a number of people that come in here, athletes in particular, and folks that have just undergone surgery for their knee. And what's going on with these folks is they're experiencing an inability to fully extend their knee. So what's happening with these folks is their knee is always in this kind of slightly bent position in varying degrees. Sometimes it's even as bad as this, or it's just they can't quite extend their knee all the way. Now, full knee extension, if you look at my leg here, let me bring this down so you kind of see. There we go. That's a little better. So if you look at this is my knee straight. And then if you can kind of see my foot and my heel should be able to come up off the mat like that. See? This is knee extension. So there should be a little bit of past 180 degrees here, about 4-5 degrees of hyperextension in the knee. And these folks, they're staying in this kind of bent, see that? I'm bending my knee a little bit, this kind of bent position in their knee. So, how do you fix that? How do you change that thing? If you're post-surgical or you're an athlete and you're always in this kind of bent knee position and your quads are just on fire all the time and you're decreasing in your performance with whatever it is you're doing with your sport. We also see this a lot with people who stand for long periods of time. Hairdressers, that type of thing. They do a lot of standing for long periods of time, and they're starting to get a problem with not being able to extend their knee all the way. It's always in this bent position. So how do you fix that? Well, here's 3 steps that you can do. 3 easy steps that you can do to help fix that problem with your knee. If you're post-surgical and you got a big scar in your knee, the first thing would be to clear out that scar using a lacrosse ball. We'll put a link in the description on how to break up that scar in the front to allow that skin to be able to bend and extend properly. So we'll do that. If you're not post-surgical, the first thing you need to do is to clear out any restriction in the knee flexors. So, right? If you can't extend your knee, bam, see that? If you can't extend the knee fully like that, sometimes it's due to tight knee flexors. So the muscles in the back of the knee, particularly the hamstrings, the calf, the gastroc, because that's also a knee flexor, believe it or not. The gastroc crosses both the ankle joint as well as the knee joint, and it is also involved with knee flexion. If those are tight, it's going to keep this in a semi-flexed position. Hamstrings too. But the big one I want you to pay attention to is the popliteus muscle. Now the popliteus muscle is a muscle in the back of the knee that allows the knee to, when you're standing, if you're like this, it allows the knee to unlock. So it does this. It unlocks the knee. And if it's tight, since it contracts, it unlocks the knee, and it stays contracted, you can't extend. You can't fully extend the knee. It stays in this flexed position. So sometimes, a lot of times, the popliteus muscle in the back of the knee is really, really nasty. So what do? You get your good old foam roller, right? This is step 1. Unless you're post-surgical, step 1 is breaking up some of that scar tissue in through there. So step 1, if you're not post-surgical, would be to roll out the junkiness in the gastroc, right? The gastroc. Start with the gastroc first. I usually recommend distal to proximal to allow for good circulation. So start in the gastroc here. And when you find a spot, don't just sit there and roll over it haphazardly. You want to sit there and you can oscillate back and forth just a couple of inches in through there. See that? And then as you move up, you'll find that you'll hit that Popliteus. And man, right in there, that Popliteus is pretty nasty. You can even take as you do this, you can even take your leg into a little bit of extension like this. See that? As you do that, right in the back of the Popliteus. You can add a little bit of overpressure on your knee like this. See that? Or you can take your good old handy dandy med ball. This is just a good old 8-pound med ball here. And I can put it right here on my thigh and just add a little bit of overpressure. And that feels pretty good on the back of the knee. So I'm working that Popliteus right there. When you hit it, you'll know you hit it. It's right in there. And if you really are a masochist, you can take your lacrosse ball, put that underneath right there. You see that on the foam roll? And you can do a little bit of range of motion in through there too. See? Flexion, extension over that that Popliteus in through there. See that? And then you move all the way up. You move into the hamstring. I'll have to move my other thigh. I can move the foam roller over a little more so I have more over to the edge so I have more space to get into the hamstring. So this is step one. Unless you're post-surgical, step one is to clear out some of that scarring using the lacrosse ball. And we'll put a link for that in the description on how to break that stuff up. But this is step one. You want to clear out any restriction to those muscles that flex the knee. So now that we're done with step one, you want to do that 5 to 10 minutes. 5 to 10 minutes. Step two, you want to get yourself, this is just a yoga block. You can use a rolled towel or whatever it may be you have at home. Something that's not too high. This is about maybe 3 inches or so. So something not too high. What you're going to do is you're going to place it underneath your heel. See that? Placing it underneath my heel there. And now you can see my knee is off the ground like this. And I've created kind of like a bridge, if you will. And then I'm going to take my med ball. I'm going to put that right there. And now this is just a nice passive stretch. It pushes my knee into extension. See that? And again, you want to use a weight that is to your tolerance. This might be too much for you, this 8 pounds. You can use a can of soup, which is about 1 pound or so. You can even just use your hand to apply a little bit of pressure on your knee. But what's great about using something like a med ball, a book, or something like that, you can just let it sit there and let the knee sink, melt, if you will, into that extended position. Does that make sense? So, you want to hang out here 2 minutes. 2 minutes. So 2 minutes, you're hanging out in here. You're letting gravity open up that back end. Now you kind of see why it's good to release that junk back here. So that way when you put pressure in the front, it just opens that up even more. See that? And then my heel is on, this could be a towel. Right now it's a yoga block. That's giving that upward pressure, passive pressure on the back of my heel. So 2 minutes, that's step two. And now, after I've only been doing this for about a minute or so, I don't have extension issues with my knee. But step three now, after you're done with this passive stretch for this, you're going to do some active stuff. So now you take this down like this, take this off. And now you're going to take this off right there. And you can do some active stuff now. Now you're going to take your hand, see that? You can even take the med ball, you can put that here back on the thigh, not so much on the knee, but now on the thigh. And now you can do some contraction of that quad. You can see my quad contracting. You can see the ball. You can see that quad kind of contract right in through here. And you can see my foot. You can see my heel come up off the mat. At the same time, when you do that, as you contract, you want to kind of twist the tibia right? You want to twist the tibia, so your toes want to twist this way, so toward the camera here. So as you contract, you're going to twist, and then relax, contract, try to twist, relax. At the same time you're twisting the tibia this way, you're trying to keep your thigh this way. So your thigh, this is the thigh, my upper arm is the thigh. You want to twist outwardly, and then with your hands you're trying to twist inwardly. See? You're twisting them in the opposite directions. So you contract here, and you're letting your thigh come out this way, but then you want to try to bring the tibia this way as you contract. Relax, contract, relax, contract, relax, contract, relax, contract, relax, contract, relax. And now you retest it. There's my heel. And just from the start of this to now, I can really feel a little bit of a difference in through there. I don't know if you can see that, but you see the difference. There's my knee hyperextends just a little bit. It's good stuff. So, again, 3 steps to improve knee flexion. Athletes, folks that stand for long periods of time, and if you're post-surgical, sometimes you're always in that bent knee position, and man, your thigh just gets tired, your legs are always tired, and people are having problems just being able to extend all the way. So do those 3 steps. If you're post-surgical, what you want to do is you want to break up that scar tissue first. If you're not post-surgical, an athlete or whatever, and you're having problems with keeping that knee to extend, having problems with knee extension like that, 3 steps. Clear out the back first with the foam roller and lacrosse ball. Clear up these restrictions back here, especially that popliteus right behind the knee. Man, that's nasty. And then you want to do that passive stretch using a towel. In my case, I used a yoga block, and then pushing down on that knee with a weight. And then you're going to do some active contraction of the quad. See? So active contraction of the quad. At the same time as you're contracting the quad, you're trying to turn this tibia, toes inward. Anyway, if you have any questions with this video, drop them off in the comment section below. We thank you for watching. We appreciate it. And if you're new to this channel, please hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop. So that way you can keep moving well and living well with these videos. Also, I know you know folks who are either post-surgical, they have problems with their knee, they got a big scar there, and they're having problems with being able to extend it all the way. Or folks that you know that are standing for long periods of time, and they're having leg pain, knee pain, all kinds of stuff, and they don't know why, and really it's getting to that end range of extension they're having problems with. So share this with them. Or athletes. Athletes are what we see the most as far as having that bent knee all the time, and man, they're always in this discomfort with their quad and leg, simply because they can't extend their knee. So share this with them. That way they can continue to move well and live well also. And give us a like, give us a thumbs up. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.